Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello, and welcome to Boomer Health at Home. I'm your host, Megan Gervin, Director of Nursing at AmeriStaff Nursing Services. I'm joined today by Megan Gervin, Nurse Clinical Manager at AmeriStaff Nursing Services. Hello, Megan.
Hello, Megan.
Thank you for joining us again today.
You're welcome.
Today we're going to talk about thyroid disorders. So everyone's heard of the thyroid gland in the body, but what does it actually do?
So it pretty much controls your cell metabolism, how fast or slow things are going. It's going to take iodine from your food and convert it using this whole long drawn out process to make your thyroid hormones.
Okay, so it is that butterfly shaped gland just on the lower part of your neck, is that correct?
Yes.
Okay, but what controls this gland here on the thyroid gland?
So there's another gland up in the brain called the pituitary gland. I can't really point to it because it's literally in the middle of your head and your skull.
Okay.
So that gland actually sends a thyroid stimulating hormone down to the thyroid, and it's going to tell the thyroid whether to turn on or turn off, to make more thyroid hormones or to stop making thyroid hormones.
Okay, so one gland controls the other?
Yes, and there's actually another gland up in the brain called the hypothalamus. That one tells the pituitary gland what to do using a thyroid regulating hormone that then tells the pituitary gland to send thyroid stimulating hormone down to the thyroid, which then tells that to turn on or off.
So it's a very easy, simple system.
Nothing can go wrong there, ever. Nope, so easy, so good. Yep.
So when I hear hormones, I think of teenagers, puberty, emotions, can't control things, you're getting pimples and you're hot all the time or you're cold all the time. What do the thyroid hormones do in the body? Is that kind of the same thing?
Well, when you're talking about teenagers, there's a lot of other hormones that are being added into the mixture. It's kind of like a giant cocktail in the body. Those might be part of it, but not all of it.
Okay.
So the thyroid hormones actually, because it's your metabolism, it's going to tell your body what to do. It's going to tell that how many calories to burn, so it affects weight loss, weight gain. It tells your heart whether to slow down, speed up. It helps regulate your body temperature, so it will either raise or lower your body temperature. It'll tell your muscles when to contract, and it actually tells your body how fast to move food through your digestive tract.
So it's essentially your brain then tells the thyroid to do the right things for your body?
Yes.
Wow.
Kind of like your set pace car.
Yeah, that's great. Okay. So every cell in the body depends upon thyroid hormones for regulation. So tell us about what happens when the thyroid is working too hard, too much. You're speeding, let's say, instead of on cruise.
So that's when your pace car is going a little too fast and it's telling everything to speed up in the body. So all of the things we just talked about are going to speed up. You'll get weight loss, which I know a lot of people, that sounds great, I'll take the weight loss.
Anytime.
Not bad, right? Don't even have to work for it. You can eat whatever you want. But the problem with that is you also get sweating. You get a rapid heart rate. You can get extremely moody and crabby, which the people around you may not love. And it just wreaks a lot of havoc on the body. It makes it difficult for your body to regulate.
Okay. So when your body can't regulate this and you are hyperactive, as you had said, what are some things that your doctors can help you with to control this hyperactive state?
So there actually are anti-thyroid medications that they can use.
Okay.
Some radioactive medications. Sometimes these don't end up working though, and they just have to evict the thyroid from the body. They end up having to do surgery and cutting it out.
Okay, and you can live without your thyroid?
You can. They'll replace your thyroid hormones in other ways.
Okay, good to know. So now conversely, we were just talking about when your thyroid's working too hard. What happens if your thyroid isn't working hard enough?
So that's when everything starts to slow down and you get some weight gain. Not so as much fun. But you also will start to feel cold and tired. Your skin starts to get dry. You can get some brittle nails. You know, depression sets in. You can get constipation. Everybody loves that. That's super fun. So
everything's basically just slowing down.
Slowing down, yep.
So a lot of those symptoms seem like cold weather symptoms. I mean, I feel sluggish, I'm tired, I'm cold, my nails get a little brittle in the winter.
We all have the dry skin going, got to moisturize.
Exactly.
Yeah.
We live in Michigan.
Yep.
So how can I differentiate then? I mean, is this just the cold weather affecting me, or do I actually have a thyroid issue?
So you have to go to the doctor.
Okay.
You have to get a blood draw. They'll poke you with a needle, send your blood off to the lab. It should be part of your yearly physical anyways. That's why it's good to continue following up with your doctor.
Okay. So when I have my blood drawn, I look at all these different levels of things, and there never just literally says thyroid. There's always like T4, T3, T3 and 4. What does all of this mean? Why are there so many? Why isn't there just one?
So the doctor's looking at that full cocktail of how the glands are talking to each other, how much of those signals are they sending out. So there will be the thyroid stimulating hormone, that's the one that's coming from the pituitary gland down to the thyroid. They're going to measure that. Is it high? Is it telling it to kick on? And then is your thyroid actually reacting? Is it doing what it's supposed to be doing? Or the complete opposite? Or are they not talking anymore? So they look at this and see what's going on. When it comes to the actual thyroid hormones in the body, there is T3, T4, and then you'll see a free T4. So there are some T4 in the body that don't connect to a protein like the other T4s, and it's only like 1% to 2%. Those can actually move into cells. So you as a layman would never have to worry about that. It's the doctor that's looking at the complete picture to see how they can control this, make you feel better, and see if your levels are normal.
Okay. So there's a lot of things that can cause low thyroid levels, like autoimmune diseases, medications, radiation treatments. What do doctors use to treat these low thyroid levels?
So it's pretty easy. There's synthetic thyroid pills. Ones that people know are like Synthroid, levothyroxine is the other name for it because they have to make it difficult to make it a tongue twister. Always. But the good news is it's a once-a-day pill. It's in the morning. Before you go to eat your meal, about an hour before you eat anything. And it's a super tiny pill, so even those that can't swallow pills real well, you can crush it. I mean, it's a very easy medication to take. Okay, and this is daily, this medication? Yep, it's daily. Yep. And then well, depending. The doctor may put it every other day, depending on your thyroid level. So it's whatever your doctor ends up saying. So as prescribed? Yes. Okay. Yes. And then with the hyperactive thyroid, you just follow again as your doctor prescribes medications. As your doctor prescribes. And they may have to adjust slightly at times. Okay. They may, put you on one dose, draw your blood levels again in so many weeks, and then kind of tailor your dose to you and what works for you. Wonderful. Great. Well, thank you, Megan. You're welcome, Maggie. That concludes our segment on thyroid disorders. Again, if you have any questions or comments, please feel free to contact us at AmeriStaff Nursing Services at 248-288-2270. Thank you, stay safe and healthy.